So, welcome to Talking Data Equity for Friday, May 9th. Very, very good to see you. My name is Heather Kraus, and I'm a mathematical statistician and the founder of an organization that's called We All Count. And the purpose of We All Count is to build tools and provide training and community for anybody who is trying to align the choices and the decisions and the process of generating evidence data projects with their equity goals and their values. And really, my very favorite thing that We All Count does is what you found your way to here, which is called Talking Data Equity. And Talking Data Equity is an informal drop-in event that we do most Fridays. I've just put a link in the chat. So that link is the homepage to Talking Data Equity. So if you're ever wondering what's happening in next week or an upcoming Talking Data Equity, you can always find it there. And the Zoom link stays the same. So if you've made your way here today, then you can use that same Zoom link that you've used today for all future Talking Data Equities that you might be interested in. And each Talking Data Equity is entirely different. Sometimes we go really deep into like a quantitative theory or a technique, like how to program something in R or what's Bayesian analysis or how to get community input into like causal analysis. And sometimes we review projects and look at how the projects would have been different with different choices. And sometimes we have special guests. And today we have an amazing special guest, and I'm just about to introduce. And just prior to that, if you're new, how the housekeeping works, what the logistics to this is that this is being recorded, and I will share the recording and all the resources that we talk about today. I'm going to share all that here in our community forum. So you can see the link in the chat to our community forum. That's not a membership site. You don't have to pay money to see the resources from this talk. And because there's so many of us here, there's already over 200, we're going to ask that you keep your microphone turned off while our guest speaker is sharing her slides and her stories. Feel free to use the Zoom chat to have conversations, comment, ask questions. But keep your microphone turned off until the last part of today, when Julie's done sharing her stories and her ideas and her work. Then we will absolutely take questions and have conversations that will give you an opportunity to turn your microphone on. All right. So with that, I really want to express so much gratitude to Dr. Julie Sweetland, who is our special guest today. And this has been planned for quite a long time, but the timing could not have worked out better. It really is exactly the day that you would want to hear from an expert like Dr. Sweetland. Dr. Julie Sweetland is a sociolinguist and a senior advisor at Frameworks Institute. And actually, several of you wrote in and asked if we could have Julie join us. So it is worth your time to suggest guests, because we will make those connections and bring your very requested special guests like Dr. Sweetland here. Since joining Frameworks in 2012, Dr. Sweetland has designed and led reframing initiatives on climate change, education, equity, childhood diversity, and more. Her skill in translating, framing researches into communication strategies has helped advocates, policymakers, and scientists drive change at the national, state, and grassroots level. And since 2017, Julie has worked primarily with the public health sector, bringing the science and strategy of framing to health topics like health equity, tobacco control, maternal mortality, and childhood vaccinations. And I have learned a lot from Dr. Sweetland's work over the years. And this moment in time really, really calls for careful attention to how we communicate. So, Julie, I'm going to turn it over to you. Thank you so much for making time in your schedule for us today.
Thank you, Heather, for the opportunity, and thanks for everyone for joining. I know all of us have a lot of responsibilities these days, but it's good to be here, and I'm glad you're here because this is a time when conversations about communication absolutely need to be had together in coalition. I've cheekily titled my talk today, What Will That Number Do? And how we can think about using data strategically to tell systems stories, which isn't always the story that we're using data to tell, particularly when it comes to advocacy and public education efforts. So I'm joining here today. I am, I support and conduct some research here at the Frameworks Institute, but really I'm here more as a spokesmodel for the amazing insights and findings that my colleagues find here at the Frameworks. We're a group of social scientists and social change strategists, and we study and then share what we learn about the culture and communications aspects of different social and scientific issues. So we live to our nonprofit mission by helping folks like you as mission-driven communicators, just look to more evidence on how to lead more productive conversations on the issues that matter to us today. So I'm excited to share some of this. As a group of academics from across the social scientists, we have lots of very nerdy fights about how to exactly define framing, multidisciplinary, cross-disciplinary arguments. And here's the simple definition that we can all agree on, no matter which part of the academy we've migrated from. It's about that framing is about making choices in how we present ideas. And we see a frame effect when a relatively subtle or superficial or small change in the language or in the presentation can lead to outsized, systematic, and predictable differences in how people respond. Um, so, sorry, I just need to change one thing here. So those choices involve where to start, what to emphasize, how we explain it, and what to leave unsaid. And framing, I believe, should be part of the toolkit, the professional toolkit of anyone working in equity or other good social change, because the way we frame equity or other topics really influences how people think and feel about it, what actions they're willing to take or not take, or support or not support. And as frames move through society, they shape the issues that the public and policymakers pay attention to, whether or not a public response is generated, or whether that issue is just considered to be something for people over there or a personal trouble people need to figure out for themselves. So those choices really do matter. Over our 25 years as an organization, we've, kind of consistently combed the social science literature to look for types of choices that communicators can make consistently that come up again and again and again, where we just know the choice we make, we should pay attention to what kind of ideas is that is this visual, right, bringing into the public mindset versus that visual. For instance, we found something as simple as showing an older person in a wheelchair. If there and there were other people, right, in the image. If you turned that person in the wheelchair toward the other humans in the photo, people did not really attend as much to the sense that this person was somehow not just that they weren't disabled, but that they weren't competent, or that they were seen as fully engaged and a part of the conversation. Whereas if that chair was kind of turned where the person was not like kind of oriented to the group, that person was perceived as more frail, less competent, less kind of respected, right? And so, right, just something as simple as the angle of some visual can really make a difference, right? And whether or not we're seeing people in later life or people with mobility devices as full equal participants in society, or as kind of other, right? And sometimes less than. So anyway, this dozen framing choices here are some of the examples. And of course, we're all here today to think about the one on the top right there, numbers, right? What do the numbers and the way we use our numbers, how can that affect the way people understand, interpret, and act on the issues that we care about? So, one thing we can do is right from the start is, for instance, just think about the data we're collecting. What are the research questions we're trying to answer, and generating data on that? So on the left side of this column here, I've got traditional public health questions. These are not bad questions or wrong questions, but I do think they limit the conversation sometimes. So how do we define the problem? How big is the problem? Which populations are affected? To what extent? In those populations, what are the risk factors? What are the protective factors? Which prevention strategies can we find traditional evidence for? And where have those prevention strategies been applied? So these are good and worthy and important starting points, but we can also look for questions, look for data and research questions that get us closer to really rethinking the systems and structures that cause the underlying inequities that cause disparities. So not just defining the problem, but asking, how do we define it, right? How is it a matter of justice or fairness? Not just how big is the problem, but where did it come from? What are the structural roots? Who's harmed? Who benefits? Which is just a little sharper than asking who's affected. How have communities demonstrated resilience or resistance to this issue so far? What kinds of prevention or strategies, right, would get to the root of the problem, eliminate those underlying inequities so we don't see disparities, and who leads in communities on those issues? So sometimes even just the framing of the research question, right, is going to lead us to different data and therefore a different type of understanding. So when we, in our theory of change as an organization, we try to work to get communicators to rethink some of those, things they've taken for granted or that are habits of the field. Because when we, as mission-driven communicators, change what we say, that changes public discourse. It changes what people hear. And that really matters because one of the strongest predictors of what people will believe is the number of times they've heard it. So we need to be out there in public discourse with our best frames forward. If and when we shift public mindsets, that is an important and often neglected source of power in shaping and pushing our institutions to respond in ways that are aligned with justice, fairness, and inclusion. So that's how we think about the importance of framing. And therefore, if it's an oversimplified, sequence, it's back and forth, and none of those arrows just kind of run into tip over the next domino as nicely as we might hope. But we do, this is in the schematic, we think a lot about how to make sure what we say has some evidence that we've pre-tested. We have a sense that what we're going out into the public square with is going to have the type of effect that we intend. So I've got three, I think, big ideas here on kind of what to say and how to say it that I hope are general enough to be applicable to all the people on this call. But I've tried to bring in some specific examples as well. And I want to just invite everyone is if you've come up with examples of your own, if my examples spark ideas for you, please add that to the chat as we're going along. That'll set us up for a good discussion at the end. All right, the first one is that order matters. Many of us were trained to start a paper or a presentation with background data, really. While this makes sense in lots of ways, I think when it comes to a public communication, there are really good reasons to rethink this habit. So order matters because what comes first has a strong priming effect. It influences how people interpret what follows. And when we start out with a lot of data without offering cues for how to interpret it, we are leaving a whole lot of room for people to misinterpret it. For instance, if we highlight a disparity, between two groups, for instance, white folks and black folks, or native-born U.S. citizens and people who have immigrated. If we highlight a disparity among groups like that without explaining the cause, our research has shown time and again that people fall back on stereotypes or misconceptions to explain it for themselves. And so if you're not explaining, if you're starting with data without explanation, you are inviting people really to think through, to interpret what you've said in terms of individualism. That's that person didn't do it, do what they were supposed to do. Otherism, that group is different and less than, or fatalism. This problem is so big, we can't fix it. So the framing fix here is not to give up on data, but rather first state a clear message and then bring in data to back it up. That's pretty different than I think what's an implicit formula that a lot of us, I know I was trained this way in my training, that you start with some spicy statistics. You move into maybe, some data visualization, charts, graph, tables, more data. You then add a citation of that study that just came out that totally proves the point you've been trying to make all along, with your hope that this ad leads to an epiphany among the public. And all we have found time and again that that's just not the way human cognition works. It's definitely not the way moving mindsets at scale types of work. Data can be, again, if we're not interpreting for folks, people will interpret for themselves. I'll give you a good example of that. Our research team decided to explore whether and how the frame element of how we begin could either reinforce or break a spiral of silence on solutions to gun violence. This is a study we were doing in the state of Missouri, where the NRA Hall of Fame, National Rifle Association Hall of Fame is located, and where the gun discourse was so one-sided that there was a bill introduced into the legislature that would make it a felony for any other legislator to even bring up restrictions on legislation that would restrict access to guns. That bill didn't pass, but it's an example of just how again, extreme the discourse was. So we wanted to think about how do you even start a conversation on this? Because that's the question lots of advocates were asking themselves in this part of the country. So we recruited ordinary Missouri residents to take part in small group research settings, conversational discourse sessions. They were given different messages, each of which took a different approach to expressing, avoiding data, and taking different stances on emotion. Researchers asked the small groups to review these messages and imagine using them to start a conversation about guns during Thanksgiving dinner. I wouldn't recommend, you to try this at home, but we use this as a way of offering a realistic and practical way to prompt participants to think about communication choices and social dynamics that either promote conversation or inhibit it. And participants were directed to assume that other dinner guests were more pro-gun than themselves. So we had they got small text, short formatted like a op-ed or a letter to the editor, that took different tones. You can see the headlines for these here. The first takes a highly emotional, basically outraged tone. The second takes a much more scientific tone. This article was filled with phrases like, according to this study, and these figures point to the need for action. And then the third was intended to be more reasonable tone. Reasonable people on both sides of the debate can surely set aside other differences and agree on the pressing need to save Missourians' lives, that sort of thing. So here's what we found, among other things. First is that the outraged tone was viewed as accusatory and politically charged, and it was rejected by participants as inappropriate for civil conversation. So it's the leading cause of childhood death in the United States now. This is unacceptable, right? That really made people less likely to want to engage in the conversation. So he said, well, that's okay. We'll just reframe it as take a little bit of the emotion out of it, reframe it as just like a clean public health statement. That did not go over the way we expected, and certainly not the way that many database communicators were hoping. So, talking about this study and offering data, the conversation immediately went into suspicion. Whose research? Who funded it? Who did they talk to? The conversation focused on science and bias, not guns or solutions to gun violence, which is where we wanted it to go. In contrast, it was viewed as the more reasonable tone was viewed as inclusive and getting past political beliefs, and participants envisioned a productive conversation following. So our analysis here, we've seen in other times, and I'll show you this in a moment. It's not that the data needs to go away, but if we start the narrative with the data, we're often again, either evoking stereotypes or begging questions that are not the topic that we actually want to discuss. Um, some years ago, we were at a public health event, and a person came up to us, after the talk and said, I work in public health. I saw you years ago, and it's made such a difference. I've given myself a little mantra. No data till the third paragraph, no data till the third paragraph, because I need to start with a value, offer an explanation, and then that data is heard in the way I attend it. So we've seen this again. This is a study we did some years back on framing immigration reform. When we were looking at, we tested three different types of studies, or sorry, three different types of introducing data. The first was a heavy dose of economic growth facts. If we had more expansive immigration policies, right, it would benefit our economy in the U.S. The second was a lot of facts around rights, so workplace protections, rate of workplace injuries is 22% higher in industries, right, that employ large number of undocumented workers, or those sorts of things. And then a narrative that started with the values, offered some explanation, and included those same sorts of facts, and ended with what we could do legislatively to fix things. And what we found was that if you just give people the heavy dose of the economic growth facts, forgive me, we saw that on the zero line is a control group that got no framing. We saw that leading people directionally in the wrong direction. These findings weren't, this particular finding was not statistically significant. So it's kind of the same as saying nothing. Rights-based facts, same thing. But when we nested those same numbers into a larger narrative, right, we could see significant, and for this type of experiment, pretty impressive, large effect sizes in terms of people saying, let's update the system, let's assist unaccompanied minors, let's come up with policies that actually protect undocumented workers. And yes, absolutely, immigrants contribute to US society. So same topic, controversial topic, putting the data in the right spot made all the difference. That cheat sheet in terms of what the person at the public health conference, no data till the third paragraph. Here's kind of the outline we suggest. Leading with a principle, a high level value that society should uphold, something like shared prosperity. In the case of immigration, it was that one. It could be justice, could be the human dignity, innate worth of all people, and then explain, right, what's going on, offer the problem where that this is often where your data shows up, right? The extent of the problem, the nature of the problem that's violating that high principle and leads from the explanation. And then remembering that we can use data to talk about the scope and potential of solutions too. That really can help people understand, right? That if we took action, right, we could reunite this many families, in the immigration example, or if we took action, we could save this many lives, right, in the gun violence example. So that I think can help a lot. I'm going to move past this one just for purposes of time and just show another place of what I mean by doing the explanation and then offering the data. So here's an explanation of how redlining worked in the United States in the 30s, 40s, and 50s, in which parts of cities typically were insurance and federal agencies drew little red lines around some neighborhoods and said those are high risk, low worth neighborhoods. And those were the neighborhoods where people of color, Jewish people, new immigrants, right, often were restricted they had to live and live in those places, could not buy homes or rent in other places. And so here, this is giving explanation of that, not just name dropping that historical policy, and then a data point to really bring home why that matters, right? So we've got this moment in the past. We explain in the second paragraph here how that means that black families in the U.S. were set on a path right away from home ownership and away from wealth. And then that helps to explain why now, for every $100 in wealth held by white households, households hold only $15. There are many, many data points that could be brought in, right, to make this kind of point. But that just one in the right spot can be incredibly powerful. Which brings me to my second point, which is that less can be more. If we stack up those statistics to emphasize the severity of the problem, we found, and other social scientists have found, that we're more likely to spark overwhelm than action. But when we reduce the quantity of numbers we share, we increase people's ability to think them through. And we also give ourselves room to offer some context and help people understand what it all means. So here, the idea is to treat your data like a curator treats art. Be selective. Don't communicate with data just because you have it. Only include a number if it's the best support for one of your larger points. And instead of spending your time going around finding all the data you could use, repurpose that time to give some effort to present it elegantly. For instance, could you rewrite the title of a graph so it tells the audience how to interpret the trend? Or could you arrange the data to clarify the story it tells? Often, the other thing is when we're using a lot of data, it's because we're using that data to tell a single story, which is we're in crisis. And if you are working closely on an issue, it is very clear to you, right, that there probably is a crisis, right? But that is your social analysis. As a communications analysis, it does not work the way we think it will, right? So we are completely inundated as information consumers, right, with stories of crisis. This doesn't have the effects that we think it will. So we're leaving the public out of the conversation when we dwell on the problem, but fail to offer a sense of solutions. We're typically doing this because we want to get people to care, to motivate, get them to take action before it's late. But as it turns out, crisis framing doesn't work that way. For the most part, it causes apathy and overwhelm. The public has a finite pool of worry, as one poetic scholar put it, and a constant atmosphere of crisis evaporates that pool of worry bit by bit. So it might garner a click on a headline, but it doesn't translate into support for long-term and bigger solutions. So let me give you an example of that from our research. And this is from work we did in the UK. I'm going to say around 2015. I'm sorry I didn't put the citation for the study on the screen here. But we were in the UK, and we're working to boost greater awareness and support for measures that would prevent and reduce child abuse and neglect. And so we tested three different ways of making this kind of making this point. The first was just a value, a high level principle that we have a social responsibility to ensure that children are safe and not a threat from abuse and neglect. That that did this, right? So that values-based message gave us significant results on, is it an important problem? Should we take action on it? Can we make a difference? And it was moving people in the right direction for both their sense of public, as it being a public good, and a personal responsibility to take action. We then thought we tested another version. We have this social responsibility to keep kids safe from the threat of abuse and neglect. And 1 in 3 children, right, in the UK, is at risk or has had this harm. Adding that number made the message less powerful. It really it zeroed out. We got no significant results on this. But then we gave a third version of that. So we have a social responsibility. 1 in 3 kids are at risk, and in every the UK, every shire in the UK, there is a helpline, right, that you can call, right, to connect a family with the support they need, or figure things out, right? So, call the helpline. And adding that solution, right? Once we talked about, it's not that the data needed to go away. It's that the data needed to be nested in that narrative and put into context, right? There is this serious problem, but there's something that's available that we can do about it. So all of that, if you would prefer not to have bar graphs and would prefer a metaphor, I'll give you this one. All of this is to think about our data as if it is salt. Anything you're cooking, right? It will be better, right? With a little bit, with the right amount of salt in it, right? It makes the flavors meld. It heightens the flavor of it, right? People respond well to it. But if you just hand people a spoonful of salt, right, you're not going to get the reaction for your cooking that you were hoping for. So really thinking about that. Show you this in a couple of examples, or just one example, one more on this point of talking about the right number of numbers, right? And the which number to really try to bring home the point. So here are two communications where the goal of the communication is to advance people's understanding and support of why we need smoke-free policies, right? Particularly in places where they haven't reached yet. So on the left, right, we've got it's data, all data used to talk about how bad the problem is, right? We need these protections. Why? Well, it's got 7,000 chemicals, 70 of them cause cancer, and 2.5 million adults have died since then, since we knew about this problem, even though they didn't smoke, because this stuff is so dangerous. But I'm not, I think the evidence I've just shared and certainly other things show that that kind of narrative, while it's true, is not going to move people to move toward equity. So, what can we do? This, on the right, we've got an example. Leading with the value, everyone has a right to a safe workplace, especially, this is the explanation, we know of particular risks, like the fact that there's no safe level of exposure to secondhand smoke. A clear sense of what we should do, a proposal. We need to make every workplace totally smoke free with no exceptions. But right now, over 10,000 workers in our state are exposed to cancer causing air at work. And then a sense of how people can get involved, right? Learn more about how cities have protected people who work in bars and casinos. So this isn't, the word equity does not appear in this communication, but it's a health equity communication because we've pointed people to the policy context. We have made a proposal that really would eliminate a lot of the racial, ethnic, and socioeconomic disparities on this issue, right? In the casinos, the people up on the 20th floor, they've got a smoke-free work environment. The people down on the casino floor, right, they're the ones being exposed to this cancer-causing chemical at work. So you can make a strong health equity argument by picking the right data, putting it in the right place at the right dose. Final point, and then I'm excited to talk to y'all. It's important that we highlight structures, not the struggles. We should be naming obstacles before the outcomes. Numbers can carry authority. Numbers do carry authority. And so it's important to use them to convey the ideas that are essential to a public, systemic types of analysis and an equity mindset. And if we're only sharing data on, for instance, negative health behaviors or health burdens or negative risk factors for other topics, or negative outcomes on other areas of interest, if we're only sharing kind of that the negative experience, we risk reinforcing the myth that poor outcomes come from poor choices. And we miss opportunities to really focus people on the underlying or the structural or policy dynamics that are causing, all right, those higher levels of burdens. So the framing fix is to share data points that help people to see the need to fix systems, not people. Leaning toward and seeking out data that illustrate your upstream causes and limiting your numbers on downstream causes. So, for instance, you might illustrate disparities in healthcare access rather than disparities in health outcomes. I'll give you a few examples of that. So, this is about really shifting the data that we're using from telling a story about who's affected to telling a story about who or what is responsible. because of who it's affecting, right? So on the left, in Georgia, 1 in 5 students has untreated oral disease. More than half of our state's third graders have had a dental caries experience or cavity. So that's important information, but if it's the only information people get, they're going to say, well, those parents are not making sure the kids are brushing their teeth. I can show you reels and reels of qualitative data showing that that is how people will experience that. But you'll get a different response when you offer data that talks about the structural vulnerabilities, right? The structural problems that are leading to that type of experience, that type of outcome. So only 9% of dentists in Georgia accept the dental insurance that covers 58% of the children in the state. And this prevents access to oral health care, which is essential for oral health, overall health. So again, very much instead of thinking, people are likely to think, well, how are kids supposed to get to the dentist? How would we change that, right? Which is different. It's placing the system, it's pushing people to think about how we change the system, not how we fix the people. Another example, compared to their I'll read this to you. Compared to their straight peers, twice as many young people who are lesbian, gay, or bisexual have smoked a cigarette before the age of 13, and the rates are even higher for young LGBT plus people of color. So nothing here that says why, right? And this outcome behavior data is true. It's if you understand the dynamics of this, how much early smoking initiation matters for lifelong outcomes. This is a shocking and troubling statistic, but most people don't understand that, and so that leads people to fill in the why, and they're likely to fill it in with individualism, otherism, or fatalism. And instead, we can do something same important point, but giving people the obstacle or the structure, right, before the struggle or the outcome. Young people who are LGBT plus report high levels of stress from discrimination. The connection between stress and smoking helps to explain why, when compared to straight peers, twice as many LGBT plus youth have tried a cigarette by age 13. Same data point, different framing, different outcome. Overall, oh, and I'll just say this helps to explain why is one of my favorite data framing techniques. Often, right, we know that the issue is complex, multifaceted. There's lots of causes, there's lots of consequences. Um, but if we want to take that spoonful of salt, right, dash of salt, not spoonful of salt approach, and just put in one, right? That leaves us sometimes feeling like we're overstating the data, but this helps to explain why framing that, you haven't overstated the data. You're saying this is one contributing factor, but in a way that doesn't use so many syllables, right? And so makes it easier for folks to understand. In general, it's better to explain one factor, maybe two factors well, than it is to list all the factors that our data are pointing us to. It's better to be clear and explanatory than comprehensive from a communications point of view. Overall, I hope I've made the point that Richard Rorty, the philosopher, gave us that a talent for speaking differently rather than arguing well is the chief instrument of cultural change. If you're on this call, you're collecting, analyzing, sharing, interpreting data for the purpose of cultural change, and your data will and is an important powering part of any narrative, but I hope you can keep working and access resources to use it differently so that we can get a very different result. I'm excited to open this up to the conversation. I will say you can find us online in all the places. Our website is a whole rabbit hole, hundreds of studies on dozens of social issues. You name it, we frame it. So if you're working on something and want to think about the framing of it, beyond data, please take a look. If you don't want to go down the whole rabbit hole, you can find the short versions on social. And we've got a newsletter that doesn't come out that often. It comes out the exact right number of times. So you can find us there as well. Heather, I'm going to turn it over to you for reactions and questions, and I'm excited to continue the conversation.
Thank you so much, Julie. You all can see just how valuable this is. And of course, Julie, because of this deep insight, is in tremendous demand. So we really are fortunate that Dr. Sweetland made time to spend with us today. And Julie, hopefully you'll take a look at the chat eventually and see there a great outpouring of gratitude and appreciation for just like the blend of clear principle with practical application is something that this particular community is so hungry for and appreciates and puts to use. And I really want to emphasize what Dr. Sweetland said. That Frameworks Institute website is a tremendous resource. They are so generous with what they share and the details of what they share and the tools that are there. And I highly recommend that you check that out. And okay, so you've all been so nice at keeping your microphones turned off while Dr. Sweetland was sharing. So let's take some time. If you're in the room and you want to ask a question and turn your microphone on, because there's a couple hundred of us, we're going to ask that you do the like Zoom reaction, raise your hand thing. So there should be like a heart somewhere in your Zoom menu that says react. And if you push on that, you can see something that says raise your hand. So if you want to turn your mic on, you can just go ahead and raise your hand and we will unmute you. If you really can't figure it out, you can just turn your mic on. We're a pretty organized bunch. And while people in the room decide if they want to turn their mics on, I'm going to take a quick scan through the chat and kind of summarize some of the group questions. And I think that there's one question that's kind of occurring over and over, which is what is the title of the three kind of framings? Can you just say those one more time?
Yes,
Thank
absolutely.
you.
And I was just typing back to someone's question. The third one, I gave it two titles. I couldn't decide which alliteration I wanted to use. I was like, I'll throw them in both. So somebody should give me a, slim it down talk. Anyway, first one, order matters. Um, and I saw some people couldn't, I went too fast on the what comes in the first two paragraphs. So typically leading with a high level value or principle and then an explanation before you offer data. The second one, less is more. And so really that's about that curating it. What's the best number, right? To make the point, not I'm expecting all my numbers to make my point for me. And then the third one, I cheated. This is the one where I had two titles. So highlight structures, not struggles, or name obstacles before outcomes. And so that's really, again, pointing to the system, fix the system, not fix the people.
Fantastic. Thank you very much.
And I know you said the recording, but I'll have the slides as well so people can grab them
Oh,
easily. Yeah.
people will love that. So we'll add the slides to the resources.
Yeah.
Andy, go ahead. Good to see you.
Hey, this was terrific. So valuable and yes, so timely. Um, I'm curious about the importance or possible importance, it's a question, of stories, humanizing the data, examples about people and their lived experiences. I think I can imply some of that from the three main bullet points you have,
Yeah.
but I'm curious if there's any pointers that you could provide that's specific to whether stories turn people off or whether they really help us want to take action or help them want to take action.
Such a good question. Depends on which type of story.
Mhm.
And so the canonical distinction in framing research is between an episodic story that tells an episode, a tale of a very particular person or event, and a thematic story, gets to the theme, gets to the trend, gets to the larger issue. Now, humans are hardwired for story. Our brains love a story and we light up, right? There are parts of the brain that light up when we get a story of a particular human. However, the story of a very particular human does not always, people don't always generalize up to the issue, right? So it is a way that you can lead people down that individualism path. Data is one of the ways you can help take an episodic story and make it more thematic, right? So you start maybe with the story of a particular individual, and then say, this is just one of the, this person, the Columbia student, is just one of over 250, right? People who have been kind of unfairly, right, caught up, in immigration enforcement, these days without due process, right? So that's one way you can do it. But yeah, I think storytelling is, yes, we need to do it. We need to do it carefully, and I think there's a whole difference. We got tons of resources on that, on our website particularly. Good question though.
Yeah. Thanks.
Great
Heather,
question, and so good to see you, Andy. Okay, another question from the chat is number 3, highlight structure, not struggle. Do you have any suggestions for when I expect to get feedback from my seniors who are part of the structural problems? For example, teachers and principals in education. Like, I think the idea is there as the dentist, like instead of being like, the kids can't read, we're going to try and say the schools aren't teaching the kids to read. Any advice for when the people in
right.
charge of that
Yeah.
structure are not down for the
Yeah,
reframe?
it's interesting. It kind of relates back to Andy's question. Like, how are you locating, like where are you placing the locus of responsibility? And so what comes to mind is, we were working on reframing the racial disparities in the US and maternal deaths, right? So Black women are 3 times as likely to die from complications of childbirth than white women in the US, for example. There are lots of statistics around that. And as researchers were working to move upstream, they moved upstream to the role of implicit bias in the healthcare system. And we were proud of that change. And then we realized, oh, we kind of just reframed from the problems with the mom to the problems with the doctor. And so we just put the blame on a different individual, or type, right? And so the thinking there is, yes, of course, implicit bias does happen in the healthcare system. We don't want to erase that, but in state accreditation of hospitals, right? Why is this not a standard? Right, that staff has been dealt with that in the training and preparation of physicians, right? So we just tried to go upstream one more step with folks to really point out, again, that we're not just pointing fingers at a different individual, but we really are getting to the structure. I hope that's helpful to the person who asked the question. If that didn't quite help, I'm happy to take another crack at it.
That was extremely helpful to me. I agree. If you're asking the question in the chat, feel free to re-up. But I think for me, that helped me distinguish between, I guess, that thing that you showed when you were doing the work in Britain around child abuse, blaming a mother and blaming a doctor. Neither one offer an actual solution, but the accreditation change offers a solution. Do you think that that's one of the
Yeah.
yeah, okay.
I mean, I might push a little bit. I might add a modifier to what you said, that it's a structural solution, right? It's not an individual solution. So I don't need to fix, I mean, yes, we do need to work with people who are holding implicit bias, but like, how am I framing the solution? I'm not framing that the solution is fix them. It's fix the policy, it's fix the practice, it's fix the structures that are shaping people's decisions and experiences. Bike paths, not biking to work, right? Building the bike path, so that, yeah.
That is such a helpful detail to insert into the way that I was thinking about it. Thank you. That is so, so helpful. Anyone else who's in the room want to ask a question? And this is your moment. Hi, Letitia. Go ahead.
Oh, thank you. Not following the sequence. I just had a wondering whether you noticed, like, if the variability of some generations or age ranges might be more sensitive to these approach versus other generations. And define sensitive as even either more likely to uptake or more likely to resist.
Yeah. So if your question is about communicators, right, which
Yes.
communicators are more likely to get on board with reframing, I do not have any actual data on that. I can say in the experience of doing this work for 15 years, I wouldn't, I wouldn't put a an age sensitivity on it. If your question is about how like the public, are younger people more likely to think systematically or that sort of thing? We're actually not seeing that. We're doing a project called the Culture Change Project, where we've been tracking American mindsets since 2020 on big issues like race, the economy, health, democracy. I'm not going to say there are no age trends, but we're not seeing huge age trends in whether or not people are likely to think systematically. And we do not typically in our research see age as a major driver of the way frames affect people. So, not to say age does not matter in society. One of our best projects is on reframing aging. Um, but it's not a big demographic driver in the things that we're learning and watching and doing.
Bless you. That was a great question. Really appreciate it, Letitia. And it would be very interesting to see some of the different we'll be reading your updates, Julie, as
Yeah.
you
Yeah.
share them on frameworks. Are there I think we have time for maybe one more question. Sue is asking, what are some major factors then that do change frames? Bless
Meaning
you.
I just got a tickle in my throat. I'm so sorry.
Hey, it's no call. We're
Yeah,
cool.
and we
It's all
should
good.
say bless you for coughing as well, not just sneezing. Thank you.
You're
I'm
welcome.
with it. Um, hmm, Framing changes due to organized groups, typically. Sorry. The
Hmm.
types of frame changes we support at Frameworks,
Hmm.
supporting organized groups in conscientiously and thoughtfully shifting the framing that they're using in order to shift the overall understanding in society. I'm not sure if that's what your question is, Sue. Like, kind of how do we reframe an issue? How does that work? But if that is your question, I would point you, and I can put this in the link with Heather. Um, to our work on mindset shift and kind of how that gets pulled off. There are lots of factors that are outside of strategist control. Right? World War II happens, suddenly we've got a new frame or a new
Hmm.
mindset on women in the workforce. Not completely overnight, but that big disruption led to a big shift. And but tobacco, the mindsets on tobacco changing across a couple generations in America. That's the result of organized advocacy groups
Hmm. Hmm.
making strategic decisions based on evidence and ultimate goals.
Yeah.
I can unmute and explain a little bit about the question if I have time, Heather.
Yeah. Go ahead, Sue.
Yeah, my question was more about when you say age is not like the differentiating factors a lot of time of like framing or when people think about frames. So what are some factors that we typically think, oh, maybe socioeconomic status
Mhm.
that I was thinking more about that line.
Okay. So one that we are often building into studies is some sort of personal experience with the topic that often. So for instance, when we were working on ensuring that the ocean was included and thought of as part of the climate change issue, number of miles you live from a seashore, right, is an effects, right, how frames affect you. Childhood vaccination, whether or not you're a parent or not. So like that is something that lived experience, which often becomes code in social change for like people who had a bad thing happen to them. That can be a lived experience, but it also could just be, do you have personal experience? Like, is your personal experience shaping how you're seeing this issue because you live close to the ocean or because you live in a landlocked state? And how does that affect the way you think about the environment? Certainly, race can play a role, political affiliation can play a role. Geography can play a role. We see typically, significant, not typically, but we often see regional areas of the United States making a difference in uptick. What we're typically trying to do at Frameworks, though, is to find framing strategies that work good enough across regardless of demographic factors, because our theory of change is, again, getting lots of folks in lots of places to use a similar framing strategy. And so we're looking for what's shared and what works across groups, not for what works best with this group or that group. Expecting and trusting then that advocates in the South will flex the tobacco frame a little differently than advocates in California, right? And they'll do additional research and kind of get into that message testing sort of things. But yeah, good question, Sue. Overall, if you're really interested in this, it's dispositional factors is what we is the kind of umbrella that that sort of thing is studied under.
That is such a cool answer. I really, really am happy to hear how much the dispositional factors are playing a role in your research rather than just like the same old proxy demographics, because it will actually, I think, help us understand equity at another level. Not that one is wrong and one is right, but it's just nice to have a larger variety of human characteristics and human experiences that we're paying attention to. Yes, agreed. I agree with everything in the chat. That I have learned so much today. It has been incredibly helpful. Thank you so much, Dr. Sweetland, for spending your time with us and sharing all of these resources. Again, we're going to share this recording and the slides and all of the links in the Data Equity Forum. And thank you so much to everybody who attended. These would not be as fun if it was just me and a guest speaker. The fact that you all show up makes this the alive reminder that you were not alone, that equity is absolutely still possible. We're still making progress. So thank you for spending an hour with us on Zoom as well. And we are back next week. We have Dr. Cassandra Ramdath. She's from Georgetown Law, and they're working on a really cool project on how to use data for equity in the prison system in the United States. So I'm really looking forward to that. It'll be very different than today. But that's what's so nice about talking data equity, is that each one is so different. So huge round of applause for Dr. Sweetland, and take really good care of yourselves. We know it can be a little bit rough out there right now. So take really good care of each other, and you mean a lot to me. Bye, everybody.